syndrome and the preventive measure, including the vaccination. So let's start with the first. Before going into the theme of today's presentation, that is post-COVID syndrome and vaccination, I will like to start with what is coronavirus, what is COVID-19, what is SARS coronavirus 2, and what are its manifestation, what are its symptoms. So what we know about what is COVID-19? COVID-19 is nothing but it is coronavirus disease, and 19 is it is said COVID-19 because the first case of coronavirus was detected in 2019 in Wuhan, China. It is also called SARS-CoV-2 because in 2003 the similar symptoms, similar to the COVID coronavirus pandemic, was seen in 2003. That is severe acute respiratory symptoms. That's why it is also called systemic acute respiratory syndrome coronavirus 2. It has gives wide range of symptoms, being asymptomatic to mild symptoms, moderate symptoms, severe, or it may lead to death. Around 30% of coronavirus or SARS-CoV-2 patients are asymptomatic, and the remaining 70%, the symptoms varies from mild symptoms to moderate, severe, and it may lead to death. So, before going to the detail about the coronavirus and its symptoms, I will like to share certain points regarding its transmission. The coronavirus is thought to be transmitted from bat by consumption of bat as food, and since no intermediate host is found till date, that leads to direct contact from bat to human. So till now, it is thought that the coronavirus is transmitted in human by the consumption of that, and within human to human transmission is basically by the most common route of droplet infection, by droplet and by direct contact of contaminated hands or other surface to the mucosa of nostrils, conjunctiva, or oral cavity. Here, the therapeutic remdesivir is mentioned in the slide. It was found that the remdesivir, that is antiviral drug, it was found to be effective in the treatment of coronavirus initially, but nowadays it is not recommended. So, as the coronavirus is transmitted in human, and it gain access to the mucosa, that is nostril, conjunctiva, or oral cavity, what it does is that coronavirus attaches to the spike protein on the mucosal surface, that is angiotensin converting enzyme 2 receptors. This receptor is present throughout the body in different organs, vital organs, and this virus binds to this receptor by spike protein 1. There is also spike protein 2 that leads to adhesion on the cell membrane of the mucosa, and as it binds to the angiotensin converting enzyme receptors 2, it leads to endocytosis within the cells, and it goes translation to form different proteins, and later enveloped, and it forms the viral progeny, which is later which is released from the cell by endocytosis, and it is spread all over the body to the system circulation in the multiple part of the body in different organ system like lungs, heart, liver, brain, and causes symptoms, wide variety of symptoms. Here we can see as the virus binds to the angiotensin 2 receptors, by spike protein. It migrates to different part of the body, affecting liver, lungs, heart, pancreas, intestine, and brain. So the symptoms of the coronavirus varies. Having multiple symptoms, it may affect lungs, leading to shortness of breath. That is, we can say, sanskrit of tharun, shortness of breath, cough. It may lead to chest pain, cause of myocarditis by affecting heart. It can lead to abdominal pain due to pancreatitis affecting pancreas, intestine, and if it is more severe, then it may lead to renal failure. And even in brain also, it can cause meningitis, encephalitis. And so, if severe symptoms of COVID is seen, then the patient may lose consciousness, that is faint, and loss of consciousness. So these are wide variety of symptoms. It is not necessary that all patients may have all the symptoms, but some patients, some high risk patients, I will discuss in the upcoming slides, who are the high risk patients. They are prone to have severe coronavirus symptoms. So the symptoms of COVID varies from patient to patient. This is the same slide which reveals the effect of coronavirus in different organ of the body: brain, lungs, leading to pneumonia and ARDS, acute respiratory distress syndrome; liver, leading to hepatitis; pancreas, pancreatitis; heart, myocarditis, leading to chest pain. So these are the symptoms. Basically, once the virus enters in the body, then it takes average around 5 to 6 days to develop symptoms, but it may take up to 14 days to develop symptoms. But on average, it takes 5 to 6 days. So these are the symptoms. The most common symptoms is fever, dry cough, and tiredness. But some patients may have less common symptoms like body ache, pain, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, and rashes on the skin and discoloration of finger and toes. Some patients may develop severe symptoms like shortness of breath and inadequate amount of oxygen in body. That is, we can say that as low oxygen saturation, what we monitor by pulse oximeter. If it is, it can be less than, if it is less than 92%, then we say it has severe symptoms of COVID. Or fever rises more than 104 degrees Fahrenheit for more than 6 days, and chest pain or loss of speech or movement. So these are severe symptoms, and if any patient or develop these severe symptoms, then these patients should have immediate medical attention and should go hospital without immediate. So because this patient need medical treatment. However, patient with mild symptoms, what I mentioned earlier, fever less than 104 degrees Celsius for 1 to 2 days, body ache, mild cough. So these patients should be managed at home, and they may need symptomatic treatment, but these patients don't need hospital care. So most of the patients who develops and who get infected with coronavirus are resolve their symptoms within 2 weeks, that is around 14 days. But there are certain group of patients, certain group of people whose symptoms deteriorates, and the symptoms may prolong. These are certain patients, not all patients, but majority of patients, these symptoms subsides within 2 weeks. But the certain group of patients, like elderly, is more than 60 years, a patient having diabetes, respiratory disease like chronic obstructive lung disease, diabetic patient on immunosuppressant drug like any patient has gone organ transplantation and the patient is under immunosuppressive drug. So these patients are prone to prolong COVID symptoms, and this patient may have post-COVID-19 syndrome, and their symptoms continue more than 12 weeks. And these patients are said to be post-COVID-19 syndrome because these symptoms, if their symptoms are not explained by other diagnosis. Suppose patient is infected with coronavirus, and after 2 weeks, the patient continue complain of cough. Patient has chest pain. So if any patient, suppose more than 60 years of age, patient is more than 60 years of age and has coronavirus, or infected with coronavirus around 2 weeks back, and patient continue complain of chest pain. So what we think, we should think other than the symptoms other than coronavirus. But after further investigation or further examination, if the other diagnosis is not explained, then what we suspect is that the patient has post-COVID-19 syndrome, because coronavirus also lead to myocarditis. Similarly, patient may have cough, fever. These are post-COVID symptoms. The majority of post-COVID syndromes, the most common post-COVID syndrome is fever, cough, fatigue, loss of appetite, that is anorexia, shortness of breath, and chest pain, and other the common COVID symptoms like anosmia, that is patient cannot sense smell, loss of appetite, gastrointestinal symptoms, and headache. So after 2 weeks of coronavirus, or after resolution of coronavirus symptoms, if patient develops organ fever, cough, that is chronic cough, more than 2 weeks, then we should first rule out whether there is any other secondary cause that leads to this chest pain, cough, and if other symptoms are other diagnosis is not confirmed, then we should suspect that it is likely due to post-COVID-19 syndrome. And these symptoms are managed symptomatically, because till now there is no such medication has been approved by FDA for the treatment of coronavirus disease and post-COVID syndrome. So I mentioned previously who gets post-COVID syndrome. So these patients are high risk, has greater risk of suffering post-COVID syndrome. The patient is increasing age, that is more than 60 years, excessive weight, obesity, more than BMI more than 30 according to height and weight, and diabetes mellitus type 2, respiratory illness, that is chronic obstructive pulmonary disease, and patient having chronic kidney disease which are under dialysis. Also patient on immunosuppression medication, that is patient taking medicine whose immunity is weak. These patients are commonly patient on organ transplant, that is if patient has undergone renal transplant or liver transplant or other organ transplant, and patient is on immunosuppressive drug. So these patients are commonly prone to post-COVID syndrome. As we know that till the date, no such drug has been approved, or most of the drugs are under still clinical trials, which is used for treatment of COVID disease and post-COVID syndrome. But so till now, what we do is just to manage patient symptomatically. If patient oxygen level is low, that is SpO2 less than 92%, then we give oxygen. If patient has secondary bacterial infection, then we use antibiotics. But if patient doesn't have a secondary bacterial infection, then we don't use even antibiotics. Just we give, if there is fever, then we give paracetamol to decrease temperature. And if patient loses consciousness, then we maintain airway by endotracheal intubation. So these are just symptomatic treatment and patient resolves as the disease, the time duration of the disease prolongs. So the major mode of treatment, we can't say treatment, but the major mode to be safe from COVID is prevention. So what we do to prevent coronavirus disease? How to prevent coronavirus disease? As we know, we have been practicing now. Wear a mask that covers your mouth and nose. Avoid close contact with others. Stay at least 6 feet, that is around 2 arm length from other people. Avoid crowds and poorly ventilated space. Wash hand often with soap and water. Use an alcohol-based hand sanitizer with at least 60% alcohol if soap or water are not available. Avoid touching your eye, nose, mouth with unwashed hands. This is the avoid touching eye, nose, and mouth with unwashed hand is one of the major steps that can prevent you from getting coronavirus infection disease. And clean and disinfected frequently tossed. Cleaning and disinfecting frequently the toss surface. And the major way to prevent coronavirus disease is getting COVID-19 vaccine. What the COVID-19 vaccine does is it builds immunity to protect you from coronavirus without getting more severe form of illness. What we have found, it's around 1 year, around 6 months since vaccines have been started. And what we found is, though it doesn't completely prevent coronavirus infection, but it prevents severe illness. And since only, I think by now around 20% full vaccinated, 20% of Nepal population is around fully vaccinated. And what we found is those who are vaccinated, fully vaccinated, the symptoms are only the symptoms present are only the mild to moderate symptoms. They are managed in wards. They don't need intensive care, ICU, or any ventilator or support. So the vaccination is in-time vaccination is found to be very effective measure to prevent coronavirus infectious disease. We start moving on to the vaccine that is available now in Nepal. The 2 types of vaccine is given in Nepal now. Initially, it was the Covishield, AstraZeneca Covishield, that is viral vector based, and Johnson & Johnson, Janssen COVID vaccine, the single dose vaccine. It is also viral based, viral vector based vaccine, and the now Neurological COVID vaccine that is supplied by China. It is inactivated vaccine. So the 2 types of vaccine is available in Nepal. Now I'll discuss about how this vaccine work. Initially, first I will discuss about the viral-based vaccine. Here in viral vector COVID-19 vaccine, the vector adenovirus is used. Again, by using this vaccine, what we can think that, okay, so you are injecting virus in body, so it may cause the illness. The adenovirus may cause its symptoms. Yeah, adenovirus is usually it causes mild symptoms like respiratory illness, cough, shortness of breath. It causes, but what they have done in this vaccine is that they have modified adenovirus virus that leads to harmless. Its effect are not much seen. That is, it has been made harmless virus, and it has been cloned with the COVID COVID coronavirus to carry the gene that encodes SARS-CoV-2 spike protein. into the host cell. So when this vaccine is injected in the body, and once this virus get inside the cell, so the coronavirus 2 spike protein gene is undergoes transcription and translation to form protein into the cell. And once this protein is formed, these proteins are broken down into pieces, and this protein are displayed on the cell surface. And as these proteins are displayed on the cell surface, what our body does is that our body immune system recognizes it, and what it senses, oh, this protein doesn't belong to our body. So what our immune system start doing is they start building the antibody against the protein, formation of antibody, that is immunoglobulins G and immunoglobulin G. And these immunoglobulins, when we get infected with coronavirus, then this antibody attack the virus, causing engulfing and damage and causing destruction of the virus. So this is the way how the viral vector COVID-19 vaccine works. Inactivated vaccine is that it has been used previously in Nepal as diphtheria vaccine. Even diphtheria, diphtheria not, pertussis. Pertussis vaccine is also inactivated vaccine. Here, the varicocele, the vaccine, here the coronavirus is killed. And once it is injected, this killed virus, it doesn't cause disease. But our immune system, what it identifies again it as foreign. So our body immune system starts making antibody against that inactivated coronavirus. And since the antibody is already formed, so when we get infected with the COVID virus, we already have the antibody and it attacks the virus. Thus, it again causes destruction of the virus, and we get defense against it. The COVID vaccines are what we have been using in Nepal and in the world. The COVID vaccine are relatively safe. It doesn't have more severe symptoms except for this fatigue, headache, muscle ache, fever or chills. These symptoms are usually seen in younger patients. Elderly patients are not prone to these symptoms. Most commonly, these symptoms are in younger patients. Younger patients usually after the second dose. Even first dose also, after first dose also these symptoms can be seen, but commonly it is seen after second dose of the vaccine in younger patients. These symptoms are usually found within first week of, usually within 3 days of vaccination. The Johnson & Johnson vaccine, that is Janssen COVID-19 vaccine, has rare side effect, which is present in around 1 lakh in 1 lakh. In 1 lakh population, 1 lakh vaccinated patient, around 1 to less than 1% it is not percent, in 1 people, it is found that certain patient has blood clotting symptoms. When injected, the blood get clotted and it leads to certain symptoms of embolism. And even the certain patient was found to have low platelets after taking vaccination. So if any patient gets vaccinated with Johnson & Johnson, and so if any patient, since it is not available now, I think the stock of Johnson & Johnson is finished. It was administered around 2 months back, I guess. Yeah, and so if any patient gets these symptoms, they should consult physician or get admitted in hospital for further supervision. There are others, rare side effects, but we should analyze the risk versus benefit of the vaccine, of the vaccine. Certain initially what was done that when the vaccination was not enough in Nepal, and certain patients were reluctant of taking vaccination. Certain patients were reluctant of, certain people were reluctant of getting vaccination due to this side effect. So during those times, what we had advised to those people who were afraid of getting vaccination, and that if you are at high risk, like healthcare workers, or if your job is that you are in direct contact with general public, so you are at high risk. So if you are high risk, then it is better to be vaccinated, because once you will get COVID vaccine, you never know whether it may progress to severe illness or it may lead to death. So risk versus benefit was analyzed initially, but these days, since around 6 or 7, around 1 year it has been passed, and vaccine is given worldwide. Most of the country is already 90 or 100% vaccinated. So we know now what are the common symptoms and what are the side effects of the vaccine. So all the people who is being provided with the vaccination should take vaccine, should get vaccine to prevent ourselves and our family from getting COVID-19. So once you are vaccinated and you are a child care, or you are any also school staff, or you are a student, so after post-COVID, post-vaccination symptoms, suppose you have fever, headache, malaise, that is whole body ache. So you should, if you have these mild symptoms, pain, swelling, or redness at the injection site, you can resume your daily activities. You can go to school, or if you are office, if you have, or worker, you can attend your daily activities. But certain symptoms are unlike the COVID, unlike COVID post-vaccination symptoms, and it has symptoms consistent with COVID-19, that is cough, shortness of breath, nasal congestion, or running nose, sore throat, or you have loss of taste or smell. This, if you develop these symptoms after vaccination, so these are not due to the vaccine. These symptoms indicates that you may have been exposed to COVID-19 in recent days, and the symptom has developed now. So if after vaccination, if you develop these symptoms, so you will stay at home and consider getting tested, or consult with a medical personnel as soon as possible, because these symptoms are not due to vaccine. Okay, then who should not get COVID-19 vaccination? Any person with a previous history of severe or immediate allergic reaction, that is anaphylaxis, to any drug or vaccine. If you have received first dose of COVID vaccine and you developed severe anaphylaxis, that is rashes, you develop shortness of breath, you fainted. So if you had history of this immediate allergic reaction, so you should not receive COVID vaccine. And till date, the vaccine what we have received in Nepal, and these vaccines are not being administered to the people younger than 16 years of age. So severe allergic reaction after first dose or any other vaccine, first dose of COVID vaccine or any other vaccine, and the patient, people is less than 16 years of age, and if you are infected with coronavirus and you have symptoms still persisting, so during this time the vaccine should not be given. If you are infected with COVID virus and you have symptoms, you should at least wait for the resolve. Your symptoms is resolved, or around 1 month. In Nepal, we practice 1 month gap of resolution of COVID symptoms. But international in other country, they recommend that as soon as your symptoms is resolved, you can take COVID vaccine. So there are certain group of people, the risks before administration of vaccine, the risk versus benefit should be analyzed, and the consultation with the medical personnel, the physician, should be done before administration of COVID vaccine. These are the individual with history of allergic or severe or immediate allergic reaction to any vaccine or any injectable medication. If you have history of allergic reaction to any drug, or while you had administered previously any vaccine that led you to development of rash, shortness of breath, fever. So these patients should consult physician, and the risk versus benefits should be analyzed. Suppose you are a medical personnel and you had history of this allergic reaction. So it is better to get vaccinated because you are prone to get COVID infection. So the risk versus benefit is analyzed, and what we do is, if we find any sorts of history of allergic reaction or anaphylaxis to previous vaccine or any previous vaccine, first dose of COVID vaccine or any other medications or any vaccine, what we do is we inject those, when we administer vaccine to those patients, we ask them to remain in hospital for 30 minutes. If this allergic reaction is not developed within 30 minutes, then it is the rare chance of developing allergic reaction after 30 minutes. Even initially, what was found that in pregnant women and breastfeeding women, there was not much study, and the clinical trial of this vaccination was mostly done in age group more than 16 years and non-pregnant women, male and non-pregnant women. So there was not much study initially, but nowadays, what in even American College of Gynae and Obs, the Gynecology and Obs Society, even in Nepal also, what we have recommended is that even pregnant women and breastfeeding women can go for vaccination. No such side effect is specifically found in those pregnant and breastfeeding women in compared to the normal adults or non-pregnant or non-breastfeeding woman and male. So, though we have recommended, if any patient comes, then what we say is that you can take vaccine, but better observe your symptoms and better be in consultation with doctors after vaccination. And certain patients who are on immunosuppressive drug, that leads to weakening of immunity, or any patient has gone under organ transplantation and or under immunosuppressive drug, those patients should also, before vaccination, the risk versus benefit also be analyzed in this patient. People on anticoagulants, anticoagulants is the blood thinning drug. When we inject this blood thinning drug, I mean, when we inject COVID vaccine in patients having blood thinning drug, there is risk of bleeding and local hematoma. So even these sorts of patients should be cautiously observed after vaccination. There are certain conditions. I have mentioned that if a patient who has history of allergic reaction to any vaccine, previously administered any vaccine or injectable drug, they should be observed for 30 minutes after receiving vaccine. Even in patient COVID, patient having COVID-19 disease and treated with antibody-based therapy, that is immunoglobulin antibody or convalescent plasma, what we recommend to those patients is that they should at least wait for 90 days after treatment to be vaccinated. And even any patient has administered, suppose Here now the cold season is about to start, and here the world is more than 60 years of patients are prone to influenza in this cold season. So this most of the patients has been, I mean, those patients to so as to prevent from influenza, get influenza vaccine. So any patient has non-COVID-19 vaccine, whether it is tetanus vaccine, what we take frequently when we get trauma, or any other form of vaccine. So we should at least wait for 14 days before getting COVID-19 vaccine. Or if you have received COVID-19 vaccine, at least wait for 14 days to get non-COVID vaccine. So these are the recommendations. Suppose you are fully vaccinated, and when you, what you may think that I am fully vaccinated, why should I wear masks in public places? Yeah, it is not recommended if you are fully vaccinated to wear masks and have physical distancing in public places. But you never know. The people in contact with you are fully vaccinated. If suppose you are in family, your all family members are fully vaccinated, so you no need, if you are fully vaccinated, there is no need of wearing masks and as physical distance. But once you are in public place, or you never know that the another person is fully vaccinated or not, or another person is having any immunosuppressant drug and has symptoms of COVID. So it is better to, though you are fully vaccinated, it is better to wear masks and maintain physical distance once you are in public place. So after vaccination, after you are fully vaccinated, and you are exposed with a patient having COVID-19 symptoms, or they are suspected of COVID. So should you quarantine yourself? It is recommended that if you are fully vaccinated, that is both dose of COVID vaccine, and you are exposed to the suspected or confirmed COVID-19 patient after 2 weeks of the last dose of the COVID-19 vaccine. So if that is called full vaccinated, so you don't need to self-quarantine if you are fully vaccinated. According to this recommendation, that is the second dose should be, the day of second dose should be more than 2 weeks. Once you are exposed to the COVID-19 suspected or confirmed patient, and if you do not have any symptoms of COVID-19, then you don't need to quarantine yourself. Okay, then here, though you are fully vaccinated, even students, teachers, and staff are fully vaccinated. The school need to continue to follow the recommended preventive strategy, including wearing masks and physical distancing, so as to protect ourselves and your surroundings, people in your surroundings, to get infected with coronavirus. This is all. I think I have covered the most needed part, and there are many more things that need to be, that can be discussed, but I don't think that is most important, except for this part. Thank you.
Thank you, sir, for such a wonderful presentation and for making us clear about the ongoing situation of the pandemic. This information is going to help a lot of people out here. And here are some of the queries that are put forward by the Xaverians. So, sir, I and Novel would like to read out some of the applicable questions collected from the chat.
Sure.
So, sir, so here, reflecting the questions from the students, I would like to ask to you, sir, In the various news feed and bulletins, we saw that news of COVID patients infected by fungus, mucormycosis, and some of the patients have severe cases of myocarditis is also seen. So, sir, why the COVID patient is more likely to suffer from those? Is it a immunity factor or something else is there which causes a severity in the patients of COVID?
Okay, I had mentioned these things in slide. Patients who are at high risk, patient is more than 60 years, and patient having diabetes, or patient under immunosuppressive drug. That is the person whose immunity is weak. So these patients are prone to mucormycosis. Mucormycosis, mucor is fungus, and it attacks the person with weak immune system. Even diabetes, it causes, it leads to immune suppression, diabetes. So patient with diabetes, elderly patient more than 60 years, and patient on immunosuppressive drug, that leads to weakening of immunity. These patients are prone to mucormycosis, and mucormycosis is usually found to infect conjunctiva eye. It may lead to the blindness. Most of the patient, those are low risk, young adults, those who don't have diabetes, or those who are not under any such medication that leads to immunosuppression. So those patients are not prone to mucormycosis. There are selected group of patients that are prone to mucormycosis. So regarding myocarditis, myocarditis is the inflammation of heart, myocardium, the muscles of heart. Myocarditis can be in any patient, even young also, or any high risk patient also. So once you develop symptoms of chest pain and you are infected with COVID-19, it is due to direct attack of those COVID virus to the myocardial cells that leads to inflammation of myocardium, leading to chest pain. So once the symptoms of around the COVID virus usually persist for around 1 to 2 weeks. So as the other symptoms of COVID-19 resolves, it leads to resolution of even myocarditis as time passes. But in certain cases, certain patients, I have found that the symptoms of chest pain prolongs, and this patient may need the medication that resolves the chest pain. So myocarditis is different, and the mucormycosis is different. Mucormycosis is only present in those high risk patients. That leads to mucormycosis of eye, leading to blindness. I think I have answered your question.
Thank you, doctor. So, doctor, we have another interesting question in there. As we have seen that some of the reputed news articles have published about the vaccination and neurological problems that are brought by it. So, what do you think about vaccines causing neurological disorders?
Yeah, certain. It is rare, but in Nepal, I have not encountered any news or even in any article that any patient has important multiple symptoms. Yeah, but it is rare. It is the neurological manifestation is very rare after vaccination. It is called Guillain-Barré syndrome, GBS, Guillain-Barré syndrome. What it does is that the neurons, there is axons, the covering axons neurons. Once in certain group of patient, commonly it has been encountered that if you have symptoms of COVID and you got vaccinated with COVID-19 vaccine, suppose you have any other symptoms like you have fever due to any other vaccine, not COVID, you have upper respiratory tract infection, you have cough, you have running nose, and you get vaccinated with COVID-19 vaccine. So what it does is that after vaccination, in certain group, it is very rare that it leads to neurological manifestation. That is Guillain-Barré syndrome, GBS. What it does is that the body immunity start reacting to those vaccines, the COVID-19 vaccine or any other vaccine. It is not that just COVID-19 vaccine can cause neurological manifestation. Any vaccine can cause neurological manifestation. Even there are many infection, gastrointestinal infection that leads to neurological manifestation. That is GBS, Guillain-Barré syndrome. What it does is that the body start attacking the virus component, and at the same time it starts attacking its own cell also, leading to the neurons. There is axon that surrounds the neurons, causing damaging of the neurons, leading to demyelination of the neurons. It leads to weakness in leg, and that can progress from leg to upper arm also. So this Guillain-Barré syndrome is present, but it's very rare. Just keeping in mind that it may cause neurological manifestation, you should not get vaccinated is very, that it should not be taken as such. It is very rare. I have read in few articles, that is not in Nepal. I think it is, I have not found, and I think till that in any patient, those 20% patient who are vaccinated in Nepal, anybody has encountered these symptoms. But one of the article I has read, it was published in British Medical Journal. There are rare symptoms of Guillain-Barré syndrome, but this just being afraid of this manifestation, you should not get vaccination. That just avoiding getting vaccination is very dangerous step. So just ignore those symptoms. Thank you.
Yes, sir. So a student had asked a kind of a myth buster about that additional intakes of vitamins and minerals like zinc and vitamin C and vitamin D can provide a special additional benefit while fighting against the COVID. How much truth is behind the statement? Is the intake really helpful for fighting against the COVID? So can you please answer it?
Regarding vitamin C and zinc, there is no specific data that it should be mandatorily used in if you are COVID-19 infected. But as we know, this vitamin C is antioxidant, even zinc is antioxidant. So when you use it, boosts immunity, isn't it? So it is not that once you are COVID-19 infected with COVID-19 or you should take this vitamins. It works in any respiratory illness, any infection. It prevents any infection because it boosts your immunity. These are antioxidants, vitamin C and zinc. So yeah, you can take, but there is not. There are not such data or any studies that has proved that, or it has not recommended that you should take vitamin C or zinc once you are COVID-19 infected or to prevent COVID-19. But regarding vitamin D, yeah, there are many studies have been done, and it was found that patient with insufficient amount of vitamin D in body, that is vitamin D3, cholecalciferol, if you have insufficient vitamin D in body, then it was found that the progression of virus, COVID-19 virus, is very rapid, and it may lead to serious symptoms, which may lead to you to land in hospital, and even it may lead to death. So what was found that once you are investigated and you have insufficient vitamin D in your body, and you replaced with vitamin D3, and it was found that it inhibits the replication of virus. I had shown in slide how virus get access to the cell and how it replicates, how it forms new progeny. So after replacement of vitamin D in those patients having insufficient vitamin D in body, what was found that the progression of COVID-19 symptoms was less severe, and even the outcome was better. So vitamin D is recommended, but before taking vitamin D, I suggest to check whether you have adequate amount of vitamin D in body. You can do by investigation by checking vitamin D in body, and if it is insufficient, less than around 15, 20, then we use vitamin D supplementation. Thank you.
Thank you, sir. There is a question. So another question that is, so question is, what happens when the time interval of COVID vaccination between the first dose and second dose is exceeded? And along with that question, why there is age limitation in the vaccination? Why the same vaccine that is allocated for above 18 can't be used for the underage people, which is below the 18? So it's the question, sir.
Okay. The vaccine what we have till date, vector-based vaccine, that is Covishield and Johnson and Johnson, Inactivated Vaccine, Verocell. These all vaccines are studied and has gone clinical trial in patient is more than 16 years old, and more than 16 years old. So we don't have adequate data. Its efficacy in patient is less than 16 years. So, but the study are going on, and one of the vaccine that is not present in Nepal, I think, is recommended for patient at 12 years of age, not less than 12, but even 12 years and more than 12 years is recommended. But till that, less than 12 years, people are not vaccinated by any form of vaccine. One vaccine, as far as I know, is administered, but not in Nepal, to people, to baby, to child 12 years of age and above, not less than. So there's no adequate data, and no, still the research is going on. But if till 12 years we can administer vaccine. What was next question?
Yes, sir.
What was the first question?
So what happens when the time interval between the first dose and second dose is delayed? So it's the question from the chat box.
You should, after first dose in Nepal, it is recommended that 21 days or 28 days gap is mandatory. And if by that time the body starts forming antibody against the vaccine, whether it is vector or inactivated vaccine. So after that, if you delay taking the second dose, the adequate amount of antibody that should be produced so as to fight against the virus is not found to be developed. So it's better to get vaccinated within 28 or 21 or 28 days. Else, if you are not vaccinated by that time, then you are prone to getting infection with COVID-19, and it can lead to severe symptoms. So it is time duration, 21 to 28 days. Better get vaccinated, but since we are in Nepal, we don't have adequate stock of vaccine here, and even I was first vaccinated, and after 3 or 4 months, I got second dose. So in those period, there is risk of getting COVID infection, and because after only single dose of vaccination, the body antibody is not enough amount of antibody is not developed in the body so as to fight against coronavirus. So if you delay taking second dose of vaccine, you are at risk of getting coronavirus with serious illness. So that is risk if you delay second dose. I think I have answered your questions.
Thank you, sir. That must have helped everyone. So I guess that is all the queries the Xavierians have. Now, moving furthermore, I would like to invite our Vikas Prajapati sir the moderator of S60 Ecosphere, to deliver a vote of thanks.
Good morning to one and all gathered here. On behalf of S60 Ecosphere Club, I, Vikas Prajapati, feel immense pleasure to propose a vote of thanks. I want to express my sincere gratitude to Reverend Father Dr. Augustine Thomas SC. I would especially thank our guest, Dr. Rajiv Yadav, for his thought-provoking insight on post-COVID and vaccination. Thank you, Dr. Rajiv.
Thank you.
I would further extend the hearty thanks to Vice Principal Sudhakar Sir and CECT members for unfaltering guidance and support for conducting this program. A special mention to +2 program coordinator, subject coordinator, teachers, and all staff for their gracious presence. Arvind Sir, Preeti Ma'am, and members of Ecosphere Club need a special mention for their consistent contribution. Sincere thanks to Noel and Ashwin for hosting the program. I could not stop thanking Vivek Sir, IT department for technical support. And my deep sense of thanks and appreciation goes to all the participant students who were live with us for their undivided attention. At the end, thank you all for being with us today. Have a wonderful day ahead. Thank you.
Now with this, we do have come to the end of today's program. Now we can all get disconnected from the show. I would like to thank all the participants who got connected in this talk. So now we all can get disconnected. Thank you for joining with us. Stay safe, stay healthy. Thank you.